So the first one we're going to do is called the foot slap. Weakness of usually ankle dorsiflexors, usually a result of an injury to the deep corneal nerve, maybe some distal neuropathy or hemiplegia. Looks something like this. Okay, second one we're going to do is the high steppage gait, which is maybe a little bit excessive hip and knee flexion. Usually result from weakness of dorsiflexors. It'll look something like this, where the individual has a tendency to pick up their leg because they can't dorsiflex their foot during the swing phase, so they're trying not to trip. And next one's going to be vaulting gait, which is pretty much standing on your tiptoes to create extra clearance for the opposite leg, clear the ground during swing phase. Any impairment of the lower extremity that reduces the ability to reduce the length of the leg. Look at something like this. And then the weak quadriceps gait, or forward lurching gait. It shifts the line of gravity anterior to the medial lateral axis of the knee. This mechanically locks the knee in extension, reducing the quadriceps activation. Usually a result of weak quadriceps, hence the weak quadriceps gait. The individual is pretty much trying to avoid any type of knee flexion. And then the geniorectivatum, I'm going to have a tough time doing that since my knee doesn't go into hyperextension. But pretty much usually the result of knee paralysis of the knee flexors, pretty similar to the quadriceps gait in regards to the knee maintains full extension throughout the motion. And then hip or knee flexion contracture, increased tightness in tissues that normally allow full hip and knee extension. Excuse me, usually result from severe arthritis. And weak glute max gait. Excuse me. Weakness of hip extenders. It can result from poliomyelitis. The individual avoids trying to go into hip flexion, so that way their glutes don't have to work to eccentrically decelerate hip flexion.